Ani Weekwemkong. Carrie Sinaway here. How is everybody doing on this September 1st on a Tuesday in the afternoon? The reason why we're here, yes, it's back to school in 2 more days. That means all the parents, the caregivers, the guardians, we're all scrambling around, getting ready and doing all the fun stuff that we should be doing and preparing for the new school year. But at the same time, it's a new school year. We're in this new world. We're living in the COVID-19 pandemic era, and that means a lot of changes. There's a lot of changes on preparing for school, what we need, what we don't need. Are we going to school? Are we going to be homeschooled? And we all know here in Weekwemkong that it's something that our parents and our families as a whole and as a community, we've all been challenged with, trying to decide what we can do, what's best for our children when it comes to their health and safety. So we really wanted to reach out collectively as a community to provide some insight, to provide some awareness, to provide some more education, and maybe address some of the concerns that you have, if not for yourself and your families, for the children, for your students, and again, as the community as a whole. So what we've done is we've put together our experts from our community, as well as our Ogama, our leadership, to speak to you, to each and every one of you, to try to address some of the concerns within this live stream for 1 hour. So again, we want to welcome everybody for joining us today. We did come out to the community last week to announce that we'd have this session here today, as well ask you, what questions do you have when it comes to education, when it comes to health, when it comes to the processes that we all have to do when sending our children back to school or being at home. So we're going to get to those. I would like to introduce first our panel that we have. To my right, we have Ogama Duke Pelche. We all know him. To his right, we have our Director of Operations for Weekwemkong, Kevin Wasagijik. And back here, way across on this side, we have our Director of Education, Faye Zakoli. And to her left, we have Mary Jo Wabano, who is our Health Services Director. And with her is Was Wabano, who is our nurse. Each one of them will be providing remarks respective to their sector, and Ogama respective to the community. And then they will also provide some questions, some of the questions that you, our community, have sent us to respond to today. So we're going to have Ogama, we're going to have Faye, we're going to have Mary Jo, and then we're going to have Kevin. So each one of them is going to come and present to you. So hopefully we get to all of your questions and maybe alleviate some of the concerns you may have going into the school year. Miigwech.
Kegi Scanlon. Ani Weekwemkong. Good afternoon, everyone. I'm grateful to be here to have this opportunity to speak to everyone as our children are about to return to school in a couple days, as you've heard from our host here tonight or this afternoon. So, as a parent myself, we obviously have all these fears and we do have these concerns, and I myself took it upon in my role as GIMA of the community to take a walkthrough of the schools and to see what other issues that might arise as we open up the schools in a couple days. And I'm assured by all the staff within the schools, all the teachers, that they are and they will be ready to welcome all of our students. And because of that, on behalf of Council, I want to reiterate that we do have a commitment to protect all of our children and the safety and well-being of all of our citizens here in Weekwemkong. And as a matter of fact, in 2013, we, as a community, we made a declaration and a commitment through the Weekwemkong Children's Bill of Rights, and which outlines a lot of the principles that we're talking about: the safety, care, education, and welfare of our children. And these are, as you know, that children are our number one priority, and we're accountable to them as we open up these schools. We all agree that education is important for our children, for their development as they grow into youth and young adults and members of our community. And they do have a human right and are essential to our future well-being, to have our community needs addressed here. So we're dedicated to seeing that our children get the best possible start in life, and education provides many of those tools that are needed for their future development. And it's important that return to school is done in the safest way possible. And I do have to commend the education staff and the education director and all those involved with our pandemic team in ensuring that all the safety protocols are put in place and to have all the equipment available for us to be able to do that work properly. So hope you can appreciate that it's been a very difficult task for all of us. But what we are experienced with some pandemic responses, and there's still some people within the school settings that have gone through this a number of years ago when we had the H1N1 pandemic, and they still recall the mask wearing, all the PPE and the disinfecting that had to happen at that time. So we do have a little bit of the skill set still available to us, and with all the appropriate advice that we're receiving from the public health and safety departments and the federal and provincial governments that are supporting our local team here, we feel that we're ready, and we've minimized the risk of opening up our schools. As you know, we did close the schools back in earlier this spring, and because of that, we effectively reduced a lot of the infections in the community. I'm not sure exactly when the last time I had an actual cold. I don't know how many people have experienced the same thing, but many of the germs that were spreading throughout the community, when I don't want to blame the schools for that, but I think that everyone's dedication to ensuring the safety of all of our community members, all of our neighbors, all of our families, that we've all done our part. And I think this next phase, that by opening up our schools, is a reflection of that. Had we not done a lot of that work, had we not complied with the recommendations put forward by our pandemic team here in the community, I don't think we would be at this point of opening up our schools in the next couple days. So we know that was a reasonable approach. It was supported by all of you, and Naandwechige-Gamig. I thank every single one of you for assisting us with that, because it is maximizing the health of our community, and the lack of positive cases in Wequemco is a direct result of that, of everyone complying with the recommendations. So I'm assured by the staff at the schools that all the measures have been taken to reduce any risk of COVID exposure within the school setting, but it's also going to be up to all of us within our homes to continue limiting our travel to areas where we could potentially become exposed to COVID-19. So I think that everyone needs to be extremely honest, extremely truthful about where they've been, because of the fact that you may be putting others at risk unnecessarily. So we've heard throughout the spring that people need some essential supplies. They have preferences on where they shop, but we're still recommending that you take every precaution necessary and to limit those external trips to areas where cases are still active. So we all have that responsibility as parents and family members to ensure the safety of all of us here in Wequemco. And I want to stress that those guidelines are in place so that we protect everyone as much as possible. So we still recommend that the contact tracing happen. Keep track of where you've been, who you've been with, do that journaling that we've been recommending, and most importantly, be honest about it. I can't stress that enough. Because we do have our Children's Bill of Rights, they're also counting on all of us as adults and and older people in the community to comply with that and set that model, set that direction, and model that behavior. So and those that have opted out of returning to school, the education department has developed the learning from home models and identified staff that will support the parents when you're taking on that responsibility. So I commend many of you for doing that, because that is our traditional way of educating our children, and is somebody forgot to turn off their telephone in here and they were reminded. So I want to say miigwech to all the leadership that sits around this table and around the video conferencing settings for the last few months, and have discussed all the risk mitigation measures that need to be in place for us to begin reopening our schools. The pandemic team, Board of Education, Naandwechige-Gamig, Health Center, and our administration, they've all taken the precautions and the necessary steps to protect all of our children from COVID-19, and are committed to accommodate as much as possible the needs of the parents and the caregivers. So you've seen many notices out there on some of those supports that have been developed for parents and caregivers. So those are things that if you choose to, please reach out to the appropriate areas, whether it's education or health, reach out to them. That's why we're here. We're here to assist you. So don't want to speak too much further, but I want to turn it over to our program leadership for them to provide many of the details that you're wanting to hear about on the safe return to school plans that they have developed. And I also want to say to all the children, please follow the instructions that you're given for your safety. Listen carefully to your parents and caregivers, and enjoy the return to school and classmates. And finally, I think it's important that we only have 2 days prior to school, but I think the adults in the community can also assist and be very neighborly and keep the noise down at nighttime to allow for our children to get the proper rest. It's important for restful, having an appropriate night's rest prior to going to school and even to work. So all the fireworks and the ATVs that are out past 8, 9 o'clock, you may get a visit from the authorities to ask you to be mindful of your neighbors and children and working parents. So miigwech dindim, mamapi minakagnon dindim.
Ani Kenagoya. My name is Faye Zokol. I am the Education Director for Wikwankong Board of Education. And I'm glad to be here today to be able to answer some questions that have arisen. In the last couple of weeks, we have held sessions, parent sessions, or community sessions, just to introduce what our COVID-19 return to school plan looks like. And there was various questions that came through there, and there was questions that were posted online. So Dwayne has pulled them all together. So I'm going to get started in answering what those questions would look like. So you might be wondering what it's going to look like when your child comes to school. First of all, we welcome all the children. Without them, our education system would not be here. And I'm really excited to see them all. Of course, it's going to be with health measures, health and safety measures that are put in place. And one of our goals right now is to ensure that health and safety measures are put in place to ensure the safety of all of our students, our staff, and our families. So one of the questions that I have here is, will the children be sent home if they refuse to wear a mask all day? The answer to that is no. We have thought of different options for children that are not able to wear masks. One of those is to have a face shield. So we talked about it among staff, what we can do to support students who have sensory issues, and they just cannot handle having that mask on their face. And that's okay. We are able to adapt to that. So there will be face shields that will be available for your child should they decide that that's the best thing for them. Another question I have here is, my child is asthmatic. I think the best thing for him is to stay at home, but he also has special needs. And that is, we want to be able to provide different options for families and to be flexible with the needs of your family. So yes, by all means, like, feel free to keep your child at home for at-home learning. When it comes to special needs, we have CERTs. Our special education resource teachers will be able to work with your child to be able to complete assignments or to provide other support. In addition to that, Ascot Wibada will be also providing supports and continuing with additional programming for kids that may be attending some alternatives to staying at home. Another question we have here is, how are students going to be supported both in the classroom and completing at-home learning during the regular school day? So what we have done is there's been a slight change that we've been able to include in that. In the past week, we were able to reassign teachers that are in the WBG program. So those instructors, teacher instructors and coaches that were in formerly the FNSSP program have been reassigned duties so that they can be there all day to support students who are learning from home. So through that, they will have I believe they're having one teacher teach so many grades, so maybe kindergarten to grade 2. I'm not sure how they have managed or what the schedule looks like, but they will be available to work with your child during the day, and that can be done through online supports, or it can be done through a teleconference as well. So expect a phone call from the teachers that will be providing at-home learning supports for your child. Another question here is, are schools providing masks? Yes, so the packages were sent out yesterday, and there is some masks that are in the packages for your child. So yes, schools will be providing masks for your children. Is there going to be a nutrition program at the schools? Yes, there are. So there will be breakfast and there will be lunch that will be available at the schools for the children. Now, for those that are going to be in the pods, I think we are looking at providing we'll be transferring some of the costs for the nutrition program. What form is needed for screening the child before coming to school? So each child would be given I believe they were given 20 or so, just a stack of health screening forms that went home to your mailboxes today or yesterday in the last couple days. And so that will be there for you to sign, because there's a portion on the health screening form that requires parents to sign. One of those is a question, an example of a question would probably be, has your child taken a fever-reducing medication in the past 5 hours? And the answer to that would be yes. And in that case, it would be best to keep your children home. So one of the things that we really want to point out is for our staff or children coming into the building, if you're sick, stay home. That's what we want to ensure that everybody is feeling healthy when they're coming into the schools, and that your child feels healthy to be a part of the education for that day. Will the CERT be reaching out to the students? Yes, they will. I think I answered that question. They will be reaching out to the students online, and they will also provide additional accommodations depending on what that might look like. Depending on what that looks like according to your child's IEP. All right, here we got some questions about one child has asthma, and when he has an asthma attack, what can we do? So what I would encourage parents to do is to work with your school's teacher so that we know that your child has asthma. Right now, I think they call it asthma season. So what we would like to do is to ensure that the staff is aware that your child has asthma and may need a puffer to get through the day. They won't be sent home for that because you've already identified that this is not anything new. This is part of a condition that the child already has. So we're looking for more of what's new. Are you feeling a fever? Are you feeling like a cold that's coming on? Are you feeling fatigue? Those kinds of things. So we're looking for something that the child may be feeling, a symptom that is new and related to COVID-19. What if the kid has allergies? So allergies are okay. We understand that kids have allergies, so do staff. It probably would be good to take an allergy pill, but you will need to note that in your child's registration or discussion with your teachers, just to let them know that it's not a cold. My daughter is experiencing allergies right now. I'm just letting you know that that's what's happening. Will assignments be sent home and then returned to be marked? Yes, please return your children's, if you're doing schoolwork that is assigned for at home, please bring back the assignments so that they can be marked. Also, the grade 12 students will be required to complete voluntary hours. So between the grades 9 and 12, each student should have 40 hours of volunteer completed. So you're going to need to get these done. And the assignments that are sent home this year are going to be the real mark. So I know that if your child is taking assignments in the high school, you can expect to see your child completing 5 hours of assignments at home. So it's going to be a full workload, and just to give you an idea of what that's going to look like. Moving down to our questions here. Will there be regular communication between the teacher and the parents? Yes, we are encouraging that. Please communicate with your child's teacher through emails or texts. There's different ways of communicating through telephone. There was some folks feel like a text is a lot better to send. Some feel like an email is a better way to correspond with teachers, and that's okay. So we want to leave this open for you to be a part of the communication. All right, we have one question here. A child who is homeschooling, will the parent be subsidized for homeschooling for their child? No, but the child will receive a computer, so we'll have your computers or your tablets available for you, or paper-based assignments if that's what families have asked for. So we want to be accommodating and to be supportive to families and to help your child complete their learning in the best way that they can. All right, so we have a busing question here. Will it be the responsibility of the parent to pick up and drop off their child? In some cases, yes. In some cases, no. So it depends on what you have marked as you registered your child. Some are picking up their kids. It is safest to pick up and drop your children off, but for those who can't do it, we will be, your child will be assigned for student transportation. Again, the busing will not be full to the max like it usually is, so a 72 passenger bus will only have about 35 kids, so that'll be approximately one child per seat, except if they are from the same household. Then we will, then there'll be 2 kids at a seat. So we still need to practice safe social distancing. We still need to wear a mask, so that your child will have to wear a mask. And also they should hop on the bus with a completed screening or a completed health screening form for the student. So parents, make sure you fill out those forms before your child catches the bus, because that will be, the bus driver will be asking about that. Is there going to be morning program for parents and after school programming? Yes, there will be. So that's another change that we have added. Before and after school programming will not begin until September 14th. So if you could just keep that in mind, we will eventually include that. There will be a cap on students, so it'll be around 25 children. Let your principal know so that you can get your child involved in that. So a question that we had is, what are the reasons to self-isolate? So the reasons to self-isolate would be, first of all, to contact your child's nurse or your family nurse and talk to them about what that looks like. It's going to be based on what the nurse says. So that's what we're going by right now. What about families who visit from other districts? Do they have to self-isolate? At this point, yes, we have been following that rule that families do. If you have a visitor, like if I were to have my family come to visit here from Thunder Bay, yes, we would have had to self-isolate. And I believe that there's going to be changes that are coming up in that. It's just not finalized yet, so keep an eye out for that, for those kinds of changes. Other parents asked about students' desks. So what is it going to look like for a child's desk? We would like to have, we are going to be having the sugar cubes. So they're made of plexiglass, or also they're called sneeze catchers. So those are on the way and they will be here. They haven't arrived yet, so we're expecting those next week. Just to let you know when those are going to be here. Will the kids have to wear a mask on the bus? Yes, your child will need to wear a mask on the bus, and it's, again, for safety reasons. We want to make sure that everybody is safe. It's not that we're trying to make life difficult or just trying to put in rules. I really care about your children, and I want them to be safe when they are coming to our schools and being a part of our system. And I also want you to feel confident that we are looking out for the best interest of your children as well. When is the first day of school? Well, the first day of school for if your child is on Cohort 2 is Thursday. So if your child is part of the Cohort 2, and I believe you will find that out as soon as you get your information packages from the schools. And I was at junior school and Pontiac School and also the high school, and they have been working on those, so many of you would have gotten it by now. Will the school send reminders of which cohort the child is in? Yes, that information is also part of the school package. And question 30, how will the first day of school be? So there is going to be a difference in how the first day of school, what the first day of school looks like. At one time, we were able to fill the gym and gather together. It's not going to be like that. So you can expect that there will be health screening forms, there will be hand washing or hand sanitizing that will happen, and then they will go straight to their respective classrooms. So We're really looking forward to the new school year, and I know that some folks are feeling a little bit apprehensive. We are here with you, and the importance of having a safe environment for your child is our priority. Health and safety is our priority. That's why we have put in these health and safety measures. And we're here to support you, we're here to work with you, and if there's anything that we can do that we haven't thought of, let me know. Feel free to give the board a call, and I'd be willing to answer any of your questions. I've gotten many phone calls from parents who have reached out to me, and thank you for reaching out to us. Thank you for attending the sessions and asking us those questions. We are here for you, and we want you to feel safe to send your children to school or to attend or to stay home, depending on what is best for you. We just want to meet your need. Miigwech.
Good afternoon, Mary Jo Wabano, District Cause, Health Services Director for Naandwechige-Gamig. And with me, I have Was Wabano. She's Community Health Nurse with Primary Care Department. We're going to tag team this Q&A. So we're going to put our notes up here on the podium. So bear with us. Hopefully you don't get dizzy watching us go back and forth. But we welcome you to the live stream on back to school during this COVID-19 pandemic that we're in. So as we know, our children are going back to work, and we've heard it. You know, their kids are back to work, back to school in 2 more days. So it is work. It's a full-time job for them. COVID-19 has changed, you know, our entire way of living, and each and every thing that we do throughout each and every day used to be a simple activity. Now it takes a lot of planning that needs to be done. We can't just get up and go, jump in our car and go shopping or go visit our relatives, whether it's locally or in Chigang or Six Nations or wherever in Ontario or Canada. We have to plan, and for most of us, we're planning to stay local. So we don't really jump up anymore. We don't get up and just say, let's go visit. We have to really put some thought into that. So now we need to think about, okay, when we're going somewhere, what do we need to take with us? And why are we actually going there? Is it to socialize? Is it really essential? And for those questions and answers, you need to think about that as individuals when you're planning. And the other is, you know, that there is a chance that you could be exposed to COVID-19. So you got to think about, am I ready for that in my own household? Have I completed my family COVID preparedness plan? And again, that's for you to think about and ponder upon. So this new reality now includes back to school for our children. And we've heard from Okama and we've heard from Faye, you know, what that's going to look like. And as the pandemic team that comes together on a regular basis, we've begun planning for that. We've had to adjust our safety guidelines. We've had to look at, you know what our home environment looks like. Am I ready, you know, to homeschool? Am I ready to send my child to school? And are the business and organizations in our community ready to welcome us as we're visiting the various services that are offered? So these new rules and these new guidelines, you know, have an impact on how we're stepping out of our comfort zone and going into that. At one time used to be just to go and visit. Now we have to have an actual purpose for visiting. So you'll see, you know, when you walk through Naandwechige-Gamig, you'll still see the need for screening. Please be patient with our staff, because that's very essential to our overall wellness. That patience and that kindness when you're walking through our doors. We'll continue to do that screening the day before, and we'll continue to do that the day of. So over the past month or so, our pandemic response team has been discussing this plan for returning to school. And we've heard from our respective leaders already on what that plan looks like. I'm going to have Was do a little bit more of information on what we've shared so far to the community.
Hello everybody, my name is Was Wabano. I'm one of the community health nurses at the Wiki Health Center. So some of the things that we've been working with the Board of Ed on has been, the constant messaging and reminders about our public health guidelines currently, to remind everybody to continue, washing your hands, performing that hand hygiene, whether it's with soap and water under your tap, using the hand sanitizer, respiratory etiquette, which includes, coughing or sneezing into your sleeves or a tissue and then getting rid of that tissue. Not traveling for anything that's not considered essential outside of our district. To continue self-monitoring and self-isolating if we need to. So I like to say that everybody should be self-monitoring either way, whether or not you are self-isolating. So everybody coming to work, we all self-monitor on a daily basis, because of course if I have a new symptom, I do not want to be coming into work, so I would be notifying my employer at that time. And just like Ms. Zakuli did mention as well, we're gonna hopefully do the same thing with our kids. If anything new starts, we're not going to be sending our kids to school. We continue to remind everybody that we do have asymptomatic COVID-19 testing every Monday and Tuesday at the Blue Med tent. So asymptomatic again means we have no symptoms at all. There's a number of reasons why somebody may choose to get asymptomatic COVID-19 testing done. Personally, I get it done because I'm a nurse and I'm needed here to do my job, to work with everybody in the community. So I do get it regularly done. So as long as you have no symptoms, you can get tested at the Blue Med tent. You can book an appointment by calling the health center. We prefer people try and book before noon on Fridays. That gives us time to prepare for the following week of everybody who will be tested. Our nurses are still, we're all in the clinic. We are kind of alternating, some we're working from home, but we're all slowly coming back into the clinic at this time. So we're still there for anything that you guys might need. If you have questions or to book appointments for other health related services, immunizations and things like that. And of course, we're still available evenings and weekends. You can reach us by calling the nursing on-call cell phone, 705-690-8941. I believe it went out on all the little magnets that were sent out through the mail. So anybody who has new or worsening symptoms, you may phone us either directly at the health center or on the on-call phone. A nurse will assess you at that time and provide you with further health guidance. So it may include referrals to a nurse practitioner or a physician for further assessment. It may include referrals to the Manitoulin Health Center COVID assessment centers for symptomatic testing. Or we also have referral process for paramedicine, which essentially the paramedics will come to your home and do your swab. Again, if you're presenting with symptoms. And our nurses are also really helping everybody to plan for return to school and work planning. So if you've been required to self-isolate and self-monitor for whatever the reason, whether it's been, travel out of the district, or perhaps you had symptoms and you didn't know what they were from, and, we've discovered what it was from at that point in time. And, then we would do a risk assessment basically, and we would determine when it's suitable for you to return to work.
So for the back to school planning, we continue to ensure that the children within Wequem-Cone, that we all have that plans for their safe return, and that we're able to provide that environment for their healthy learning. And when we think about what we're doing with Naandwechige-Gamig in combination with Board of Education, we're providing the schools with the face masks. So a whole bulk of masks were purchased and provided to the schools, and now they're being distributed to the children by sending them home. So your children will have those masks available to them. We're also prepared to provide hand sanitizers. We just, whether it's the individual little hand sanitizer per child, those details still need to be coordinated. We continue to provide the asymptomatic COVID-19 testing at the Blue Med facility for any of our staff across the board within Wequem-Coong and Cedar Territory. And then also providing the health guidance and recommendations for staff for the self-monitoring that may be required.
Hello again. Okay, so our community health nurses have actually been really busy the last, what am I going to say, maybe 6 weeks? Sorry, I'm looking at Faye when we started doing PPE training. Yeah, it's been about the last 6 weeks. So our nurses have been doing PPE training across, Wequem-Coong. And then I know Julie's busy today, doing all kinds of Zoom training sessions with staff. So we continue to provide that support with our educators, just so that way we can really provide that support to our teachers, our staff, to make sure that your children are safe and that we're all doing the same thing. Aside from in-school provisions, we are encouraging families to consider asymptomatic voluntary testing option, not only for parents and grandparents who are at home, but also for our children. We do and we can test our children without symptoms. It doesn't take long at all. By the time you walk in and leave, it takes anywhere from 10 to 15 minutes. The whole swab itself takes 8 to 10 seconds. It's really important that we are doing this asymptomatic testing to make sure that our children are not carrying a virus around and potentially spreading it unknowingly. We have had children present. The research has shown that the children present with different symptoms, and sometimes they're not as classical as they would present in adults. So that's why we're trying to really encourage that parents are aware that we will swab your kids. Of course, if that's something your children are, wanting to do. Oh, sorry, I have another question here. So, let's see. Some children who have underlying health problems, like asthma, may produce symptoms similar to COVID-19. Should parents simply keep their children home if their teachers cannot tell the difference? So, the answer is not as easy. This is where we're going to really need coordination of good testing, protocols, and public health guidance. So we have that. We've been doing that, and if you want help with that and it's really a question that you're really concerned about, please call us. You can call the Nursing On Call cell phone anytime and ask those questions, and we will work with you to provide you with the best answers for your situation. So of course, that's not always as black and white when we have pre-existing chronic conditions that become exacerbated with the seasons. And Faye did say that, the teachers and the schools are really wanting to work with parents. So if that's something that we can provide to make the transition easier for you and your child, maybe your child really wants to be in school, we can work with you guys to provide that health teaching and that education with your family and your child's teacher and the school. So that way everybody's comfortable with other conditions that may present with symptoms that look like they could be COVID-19. What else do we have here? Allergies. That's been another common theme that we've been presented with, and it's kind of the same thing. You know, if you're presenting with symptoms, our nurses are basically doing an assessment. Then we provide you with health guidance from there. So it's not always, like I said, it's not always black and white. There are different risk factors that we take into an assessment before providing that health guidance, and then those return to work planning, or in this case, returning to school. This will be a work in progress. So if everybody, you know, we all need to be patient with each other and respect one another, love one another. This is going to take some practice before we find the comfort zone, but there's no simple solution for it. We're going to have to go through a period of some inconvenience and some hassle, but it just cannot be avoided. Again, our nurses are always available. Any referrals that maybe need to be done, we can do those for you. All it takes is a simple phone call. We also continue to provide immunizations for all of our community members. So anybody who potentially missed grade 7 immunizations last year, because they would have been immunized in school last fall. So a lot of kids probably have missed their spring immunizations. Just a friendly reminder that we're still doing that, and we still encourage everybody to come in and get their immunizations, because that kind of keeps our community healthy. And my last point on this subject, this question here, is our annual influenza vaccine. That will be available to everybody in the community sometime this fall. So it all depends on when we receive the vaccines. It's usually the end of November, September, early October. So a notice will go out at that point in time, and we would really encourage everybody to get their annual flu shot this year.
I get my annual flu shot every year, so that's I'll now continue to do that. So the question about parents and school boards protecting our child if they're taking the school bus, we've heard that answer from the Board of Education. Again, it's important we have our children practice wearing their mask. You know, we get in our vehicles, you're taking your mask with you wherever you're going into that establishment, the child puts on the mask. The same thing would be for when you're getting on that bus. Again, practicing the hand hygiene through washing your hands, using the hand sanitizer, you know, following all those etiquettes that Was mentioned earlier. Those are some of the routine practices that we need to follow. And as you know, mentioned earlier, the nurse's goal is to empower our community members with the best information and the health guidelines available, so that as families, we make an informed choice about our health decisions. As parents and caregivers, and as community at large, you know, we're the first teachers of our children. So we need to do that for our children, so we're protecting them. And it starts within our own home. So let's continue doing what we need to do. Let's continue practicing those health precautions, following the physical distancing, wearing the face coverings, limiting our social activities, and maintaining all the respiratory etiquettes, and keeping up to date, as mentioned earlier, with regards to immunizations. And let's get back to some kind of normalcy with our children. Let's continue reminding them that, you know, they're going to be they need to have that education component, you know, so our community can continue to thrive. Our children will adapt well, and we know that. If we all do our part and we role model what needs to be done as community members, as adults with our children, that new normal will be the lived experience of our Binochik. So we thank you for giving us this chance, you know, to provide some context to how we're going to further support each and every one of our children and our families as we walk through this journey. Naandwechige.
Naandwechige-Gamig, Joe and Was, Faye and Gimo. I'm Kevin Naandwechige-Gamig, Director of Operations for Weekwamkong. And we're wrapping up the longest March break ever. So when you get back to school, kids, you're gonna have to do your story on what I did on my March break. But seriously, it has been a long haul to get to this point. All of our team, our council, GIMA, in terms of their leadership and direction for our community, keep us safe. All of our staff, certainly our health center staff, dealing with this pandemic, our health team has carried a tremendous load. When Was was talking about the hard work of our nurses, it started in March. It has been a long haul for everybody. We formed a pandemic response team. We've been meeting weekly, trying to assess current situations, trying to provide advice certainly to our leadership, and make decisions in the best interest for the health of our community. And certainly to all of you, to Weekwamkong, to all of the families that are out there, and the children, Chimiwech, for your patience. I know it's been a long haul for everybody. Everything's changed around us rapidly. I never imagined that when I went to a bank I'd have to wear a mask, but here we are. So it has been a momentous change for everybody. But our key priority in the community has been the health of our community, and as Gima talked about, represented by our Children's Bill of Rights. I know in the home I grew up in that the children are always a priority. And so, in terms of returning back to school, the children remain a priority, certainly for, I know in the families, but certainly to us as a community. It's important that the children remain a priority, and we're doing all that we can to make sure everybody stays safe. Each of us have to do our part, and it's important, as Gima talked about being honest with ourselves, but honest with the community about where we've been, where we're going, and for you to keep your family safe. We talked about the contact tracing, your pandemic plan, your COVID plan in your household, so that again, it's our personal responsibility to take care of ourselves and our families. And as adults, it's our responsibility to be that role model to the children. Again, if we're taking the appropriate steps, they're watching us. They're always watching and listening to us. And if we take the proper steps, the children will as well. When they return to school, if we're wearing our mask when we need to, we keep our social circles smaller, we're not traveling all over the place. The children, again, as Mary Jo mentioned, they'll adapt. The kids are going to adapt faster than us. We have to be innovative. We have to be creative how we're doing this. So it's going to change. I don't know how it's going to change yet, but it's going to change. We're trying to get back to normal, whether it's returning to children returning to school, staff returning to the offices. We're trying to get back to some sense of normalcy. But again, it takes all of us to be creative. We're trying to balance the needs, certainly of the families, the children, but from an administration point of view, we're trying to balance those needs with the needs of the community as well for service, whether it's from our state's office, our membership, from lands, from water delivery, what have you. We're trying to be able to deliver those services as best we can, and balance the needs with parents taking care of their kids at home. We've talked about the cohort system that's going to be rolled out on Thursday, where some of the kids are going to school Thursday, Friday. Some of the kids are going to be going to school Monday, Tuesdays. And that creates, again, those challenges for staff returning to work. And it was my commitment, and it still is, that I want these children taken care of. And we're going to do our best to try and accommodate the parents so that they can be at home to take care of the kids when they're needed. There's no one single solution on how we're going to do this. I know some people perhaps get frustrated with my answer to them is to talk to your manager. When asked the question of how are we going to accommodate, because the family needs are different, the work environment's different. You know, the demands on our water truck drivers are different than perhaps on the nurse, perhaps different than somebody in the lands office or in Ontario Works, or certainly our teachers in the schools. So again, we have to try and be creative, innovative. We have to work together to try and find those solutions. So like everybody, I've got a few questions as well. What are the options for employees with children that are being homeschooled or are only in school for 2 days out of the 5 days? So just as I mentioned, it depends. Talk to your manager. Again, my commitment to each of you is that we're going to work to accommodate as best we can, maintain that job security as much as we can, because that's how you take care of your family. We recognize that. Will I be allowed to come into work late and leave early if I have to pick up my children at school? Again, we're going to work together. We're balancing all of those with the needs of the service to the community. Each job we have, whether it's today or back in February pre-COVID, the reason we're in the seats that we have, the jobs that we have, is to provide the service to Wikwemko. And so we're trying to balance all of that. How will I be supported if I work at home? So we've continued to try and accommodate that as best we can, outfit the staff with what they need, whether it's some technology support that we've heard even with our students. We've got Microsoft Teams. We've provided some staff with laptops. We continue to work to try and find ways. Maybe there's different parts of their job that can be done at home versus having to be in the office. We're trying to find ways to make it work for everyone. If there's an outbreak, and now this is the most challenging one, a challenge that we talk about quite often at the pandemic team table, if not every meeting. What do we do if there's an outbreak? So my answer to that quite simply is we're going to take any and all appropriate measures to maintain the safety and the health of our community, as we've done since this started. What does that mean? It could mean closing buildings, closing schools until we get a handle on the situation. It might mean a short period of time just for some cleaning, depending on the situation. It could be a bit longer, but we are going to take all appropriate steps to make sure our community continues to be healthy. And that takes all of us working together. And our commitment from our administration, working with our health team, working with our education staff, all of our staff in Wikwemko, under the guidance of our council, is to do that, is to keep Wikwemko safe and as healthy as we can. So I know again it's been a challenging time for everyone. Miigwech, and look forward to speaking to all of you very soon.
Miigwech, Kevin, for those words. Miigwech, Mary Jo, Miigwech, Faye, and Miigwech, Ogama. And you've heard from each one of our speakers here today representing our community well. The amount of work that's been done for the love of the community, to take care of our children, to take care of our families, to take care of the elders, the work continues. So what you hear today, we're all coming together just to share that insight, to maybe help our moms and our dads and our caregivers, our guardians feel a little bit more secure about us approaching and getting our children back into school. So, you know, I hope that everybody had that opportunity. I hope some of the questions or most of the questions were answered here today for the last hour. And again, keep in mind that this does not stop. This is going to continue. Our pandemic team continues to work together on a regular basis. So as we're going into the schools now, we're going to be monitoring the whole process and keeping on top of everything. So rest assured, everybody here plus everybody else that's working on this is going to make sure that our children are safe and healthy. And another thing to keep in mind is, take care of yourself too, mom and dad, and guardians. These are stressful times. There's a lot of challenges. Self-care is very important. We heard that this morning when we had our mental health team from Naandwechige-Gamig on a call. You got to take care of yourself. Set that example, as Kevin said too, role model for the children. But also, don't be afraid to tell your children maybe you're afraid, and maybe we should talk about this together collectively. And that again is strength, and that's what everybody here at the table exemplified. We have the questions, we have the challenges, we have the fears, but we're all coming together to plan to create a more solid Wequemcong. So again, services are available, whether it's mental health, our education, our administration, our health services. If you need to talk to somebody, reach out. The information is there, and you can contact each one of these individuals as well. So we want to say miigwech to everybody who joined in for the last hour. And again, don't be afraid to ask questions if you still have any more. Bama.